Historically, we did not have many evidence-based guidelines to select a mismatched unrelated donors. However, recently there's an awesome paper that was published that can exactly answer that question. So the paper that I'm specifically talking about, this was from a German group of investigators. They looked at more than 5,000 patients through CIBMTR registry, and they divided that patients into two broad groups. So one was the fully matched unrelated donor, 10 of 10 unrelated donors, and the second group was 9 of 10 mismatched unrelated donors. And within that mismatched unrelated donor category, they further divided that group based on if they were matched at the PBM site or not, specifically the peptide binding motif site or not. So what they showed was that the donor-recipient pairs who were matched at the PBM site had significantly improved outcomes as compared to patients and the donors who were mismatched at the PBM site. So this definitely gives us a little bit more flexibility in choosing the donor based on the PBM site rather than the old traditional way of matching just at the HLA loci A versus B versus C. So I think the other factors that we need to consider for donor selection are the donor age, which is generally an overlooked factor. And multiple new studies have shown that selecting a younger donor is associated with improved outcomes as compared to the older donors. The study that I just referenced, they did not take into consideration the donor age. So newer studies will be done looking at that specific factor along with the PBM matching. And the other factor that was kind of overlooked in this study is that this study focused predominantly on patients who underwent transplant with the traditional GvHD prophylaxis approaches, including calcineurin inhibitors and methotrexate-based prophylaxis, although the field now is moving more towards the post-transplant cyclophosphamide-based prophylaxis and some of the other novel GvHD prophylaxis regimens. So the unmet needs in terms of the donor selection for mismatched unrelated donors is still the how we best implement that with the novel GvHD prophylaxis regimens that we're using. And this study that I specifically mentioned, as I said, they use the traditional GvHD prophylaxis regimens while the field is moving more towards the novel GvHD regimens like post-transplant cyclophosphamide and other graft manipulation strategies. So how that will contribute to the donor selection remains to be unknown.